In lieu of any kind of training video, I just want to share some thoughts with you why I think talking about constipation is so critical for practitioners, especially CellCore practitioners, right? We come from, I speak because I am one, we come from all walks of life and all different training. And I think we've been trained to ask about bowel movements. We've been trained to say, are you moving your bowels every day? And for practitioners not understanding the importance of both the question and the answer to that, I think a lot gets lost. And I think we lose the opportunity to really capture that client from the get-go. When they're not moving their bowels regularly, you say, are you moving your bowels every day, for instance? And they say yes. If you move on from that question, you're not asking, how do you move your bowels every day? Is it after 4 cups of coffee on an empty stomach in the morning where your stomach's gurgly and you're rushing to the bathroom, where you're sitting there for 20 minutes trying to empty your bowels? That's a hell of a lot different, right, than somebody with a smooth moving bowel that curls up like a snake on the toilet. We're looking at the Bristol stool chart, right? We're smack in the middle where we want to be. Really discussing with a client what that looks like really gets clued in. My background is Chinese medicine. We ask a million questions. And so I think some education around that would be really helpful. We talked about the fact that the last year's eco seemed a little bit too far out there, and people really were longing for those clinical pearls that they could take back to practice on Monday. That's what I hope to do by really digging into what is constipation, right? The formal idea that it's moving your bowels less than 3 times a week. We know it's not moving your bowels every day without prodding it with coffee or having to jump through hoops to have a bowel movement. So what are those factors, right? And that's what I hope to explore with people. The food that we're eating, is it enough fiber? The water we're drinking should be distilled, we all know. Are there medications they're taking that are slowing down bowels or speeding them up before they get to see you? Are they moving their bodies, right? Peristalsis, moving your body moves your bowels. We know that too. What do their magnesium levels look like? What is their, do they have hepatic insufficiency, right? We know in step 1, we use kidney and liver or TUDCA to move the bowels. And we know that helps, right? But getting a jump start by figuring out lifestyle and foundational, especially looking at dairy. So that's what I hope to do in 30 minutes with some really helpful handouts, asking about diet, really digging into diet, having your patients keep a 3 or 4 day food journal. Having people understand what the Bristol stool chart is, right? I don't think a lot of Western docs understand the Bristol stool chart. So spending just a few minutes going over basics, reviewing it with people, that's where we start always, how we move the bowels if we want to do any kind of detox. So I'd love to share that with our community. If you have questions, I'd love to discuss it further over a call or Zoom.